Thank you, Crystal, so much. Thank you to Peter and Ricky for joining us this afternoon. So, Peter, how can your solution help with fracture detection and trauma-related findings like lipohemarthrosis or dislocations?
Yeah, thanks for the question and thanks for having me. We are a small AI company coming out of Denmark, but selling fracture solutions, AI fracture solutions. We are basically doing fractures for the whole musculoskeleton and helping a lot of clinics out there doing understanding and researches on their bones. So when you fall and you have a breakage, we make a small bounding box when you're at the x-ray. And that way we can find mistakes or not mistakes and help patients in that way.
Awesome, thank you. So, Robbie from Axel 3D, how can your solution help clinicians make their treatment plans patient-specific?
Yes, thank you. First of all, thanks for having us, and it's great to be. I suppose from Axel 3D's perspective, we are a company for 9 years now, and what we do is we complex diagram images. Hello? Is that better? There we go. Yeah, I think so. What we're doing is we're taking complex DICOM images, CAT scans, CTs, MRIs, and we're automatically converting those into data-rich 3D digital files. And ultimately what we're doing is we are taking these complex cases and we are assisting surgeons and assisting physicians around the world with regards to their complex cases, whether it be cardiovascular, orthopedic, neuro cases. We are really giving them a data-rich file to work off and enhancing accuracy and giving them that ability to work within that patient and to get the best treatment plan together for the patient. And ultimately what they're also doing is educating the patient on what the pathology is and further educating their surgical teams going into the theatre, allowing them to better understand the process and allowing them to better understand the approach that may be the best approach possible for that patient to ultimately improve a patient outcome.
Cool, and I guess we're near the end of the year, so anything, I'm doing a spontaneous question, so get ready for this. Anything coming for 2025 that you want to shout about and share what's coming for you and your products? Who would like to go first? Go for it, Robbie.
Yeah, I suppose we really work closely with physicians and hospitals and point-of-care units around the world, but a big driving factor for us is the work that we can do with medical device companies. We've seen that a lot of our workflow fits directly into medical device companies, and whether that is automating segmentation processes, whether it's looking at automating measurements, automating image acquisition processes, landmarking, and automated guide design as well. So really what we're doing is yes, we can assist hospitals and point-of-cares, but the work that we're doing with regards to accelerating patient-specific programs across medical device companies is a really exciting aspect for us and something that we're really looking forward to driving in 2025.
Awesome. Thank you so much. And Peter, what's to come from Radiobotics in 2025?
Yeah, thanks for the question. I think from our end, it's very much about a globalization approach. So getting our Fracture, our main product, out to all the customers around the world. So a lot of registrations going on and so on. Besides this, it's also about making sure that we expand from the emergency clinics into the radiology units and making sure that it's not just fractures that happens at the emergency clinic that gets screened, but also into the radiology units. So basically going not just in the point of care, but also in the back to help out on that. Secondly, I think the most important thing is to say that we're moving, expanding our approach. So not just the current fractures that we're doing in lipohemarthrosis, as you're mentioning, but also other areas of focus that are quite interesting to physicians, so that we sort of being more of a point of care in holistic views, so to speak.
Okay, thank you very much. Audience members, are there any questions? I don't think, does anyone like to ask anything? We've only got a few people. Any questions that come to mind, gentlemen? No? Okay. All right, well, we're going to pause there. Thank you so much to both of you for coming to speak to us today. We really appreciate it, and we look forward to and wish you the best RSNA for 2024. Thank you, guys. Bye-bye.